Let's Beat Breast Cancer rolls on here on the Exam Room podcast brought to you by the Physicians Committee. My guest today is somebody who has a journey to tell us about. She is still in the middle of it. She is a former guest of the show. And if there was anybody who is prepared to face this journey, it is Alison Tierney. She is the founder of Wholesome. And it is such a privilege to have her back on the Exam Room with us here today. Alison, thank you so very much for being here.
Thanks for having me, Chuck. It's an honor to be here.
The honor is all mine. And in all honesty, I never thought you and I would be sitting down to do a show like this. You have been on the show previously, but you were talking about your work as an oncology dietitian. And then here we are today. You find yourself in the middle of a breast cancer battle. Let's talk about this. You were diagnosed in May of 2022. When did you first know that something was amiss?
Yeah, that's a great question, man. So I actually found, I should say, my OBGYN found a lump during my annual exam in actually April of this year. And it was actually only 10 days post breastfeeding my second child. So it was very quickly after finishing breastfeeding with her. And I went for my annual exam, and just during the self breast exam and the breast exam that she does, we found a lump. And we didn't really think much of it because it was only 10 days post breastfeeding. For many people listening, they know that breastfeeding can change a lot of things about the breast. And we thought, clogged milk duct, whatever it might be, we just didn't really think much of it. However, I went home and made sure that I could feel the lump myself and kind of kept an eye on it. And I really think it was my job, the people that I work with, all of the things that allowed me to go home and just have this intuition to be able to feel the lump, kind of feel what it feels like, and if it changed or if it didn't change, to kind of keep an eye on it. So that was in April of 2020 this year, and we didn't really do much about it. Now, fast forward a few weeks, I kept feeling it, and every time I felt the lump, I felt really anxious. That's the only way that I can describe it, is that I felt really anxious. I had had a lump before between my pregnancies that had been ultrasounded, went away after a cycle, and it just went away. So kind of part of me thought, well, maybe it'll just go away too. But after it didn't go away, I messaged my doctor, mostly because I was preparing for a conference where I was the main breast cancer nutrition speaker, and came across some of the research and studies about breast cancer after breastfeeding. I thought, oh, I feel like this feels like a really good sign that I need to have some peace of mind. So I messaged my doctor and said, this lump hasn't changed. I continue to feel it. And she was very swift to get an ultrasound scheduled. So I went into the ultrasound. I think it was about a week after that. So this is May of this year, very early May. And I was in the ultrasound. And because of my work in the oncology space, I felt very familiar with what happened. And it was almost like I could just tell during the ultrasound that things were not necessarily looking the way they should look. And the tech left the room, and I had a ding on my watch saying that I was scheduled for a new procedure. And I thought to myself, oh, they just scheduled me for a mammogram. This really isn't what it's supposed to be. And went in for my first mammogram ever, and had the mammogram. And then at the facility that I go to, you go into the next room, and thankfully they deliver that day results. They have the radiologist look at the mammogram right away. And so I sat in the next room, and I was very nervous, and she walked into the room, and I could just read her face. I knew exactly what she was going to tell me. And she said, so, and I just broke down crying. And the reason for that was because I felt like I've seen every scenario play out from here. I've seen, the good cases, and I've seen the very severe, unfortunately, life-ending scenarios as well. And so when there's so much unknown, that's all you can think of, is you go straight to the bad. So anyways, she said the next step was that we needed to get a biopsy. And I said, well, how soon can we get a biopsy? Because I'm supposed to hop the plane on Friday to be the main speaker on breast cancer nutrition. And she just kind of looked at me like, what? And so thankfully they were able to schedule a biopsy within just a few hours that afternoon. Got my biopsy. So this was a Tuesday, diagnosed on Thursday, and boarded a plane on Friday. And then after the presentation and that weekend, the following Monday, I met right away with a surgeon and talked about the next plans. So that's kind of where it all started. And there's even more to dive into if you want, but I'll let you ask any questions you have from
Y-
there.
Yeah, for sure. I mean, I'm trying to put myself in your shoes, and obviously I'll never be able to, but that seems to be such a jam-packed week full of emotions. Then you've got the kids, then you've got the conference, the travel that comes with that, and just the not knowing and the angst and what are the next steps? And man, I just has there ever been such a trying week in your life?
No, I mean, probably those that week and the week that followed are probably the most difficult in the entire journey because it's so much of the unknown. The unknown, we fear the unknown. And there's this quote out there, and I don't know it perfectly, but it's really like when we don't have knowledge about what's going on, we can lead it to believe to be so much worse than it actually is. And I think that's what happens for most people in that situation is that you fear the worst, and you absolutely do. And the other thing too was, I was diagnosed here and I hopped a plane by myself. I was, leaving my family for the weekend. And of course, my husband's going through this emotional experience as well. Although he's not physically going through it, he's emotionally going through it. And here I am going to board a plane and leave for a few days. And everyone told me, my whole family, I don't really only shared it with my family, like, you don't have to go, you don't have to do this. And I thought, I think I do need to do this. I need to do this for me. And I need to have this experience of something that I was looking forward to. And I only told one person at the conference that I was going to about my diagnosis because we didn't have a whole ton of information quite yet, but I also didn't want it to be this really awkward experience where I was diagnosed and I'm speaking on the topic without all these questions. So I think that was really hard, is leaving my family for the weekend and being alone. And of course, my husband was worried about me too. So it was definitely a trying weekend, but I'm actually really glad that I did it. And it was a plant-based nutrition conference about lifestyle medicine. And so it was like kind of the perfect thing that I needed that weekend anyways.
For sure.
Mhm.
And the other thing that strikes me is when you've been on the show previously, we've talked about your other health struggles, which brought you
Mhm.
to a plant-based diet to begin with. And so you are a very, very, very healthy eater. You do live a very healthy lifestyle,
Mhm.
and yet you still got this diagnosis. I know that you must have thought about those two things. Did you ever ask yourself, why me? What did I do?
100%. I think everybody asks that question. And I think it's helpful, but really hard to also hear when people hear about the diagnosis, say, like, you're one of the healthiest people that I know. And that was really hard for me. And I actually really happy to hear that I'm the healthiest person that they know, but at the same time, really difficult that I still end up with this diagnosis. But at the same time, what might be surprising to some people is that I'm not 100% surprised. I mean, I am surprised from the standpoint that I was diagnosed at the age of 33. My mom's a breast cancer survivor. My grandmother on my dad's side is a breast cancer survivor. My godmother, who's my mom's cousin, is a breast cancer survivor. So we had this really extensive family history of not only breast cancer, but other cancers. So it's kind of part of the reason that I switched to a plant based diet was because of not only my PCOS and infertility that I know we've discussed here on the show before, but because of this overwhelming amount of cancer in my family. So, from a standpoint, I'm not super surprised, but at the same time, how early I have experienced this diagnosis is one of the things that is um, so surprising, I should say. And based off of that, I was actually surprised to learn that I do carry a genetic mutation. So, my mom was diagnosed at breast cancer at 49, and we actually never had genetic testing done with my mom's breast cancer diagnosis because they didn't believe that it was related. They thought it was hormonally related because my mom had had a hysterectomy and her thyroid removed. So they related it to the hormone replacement therapy that she was on for just a short period of time. So when I was diagnosed at 33, I automatically qualified for genetic testing. But then when it came back, the genetic counselor called me and like, we actually did find that you do have a mutation. And I thought, what? Really? Because only 5 to 10% of cancers actually have a genetic mutation related to it. So it was actually
Mm.
a little bit surprising. So as you can imagine, there was lots of emotions back and forth, like, not surprised. This is my family's history, but I tend to be the healthiest person people know. And so there's lots of emotions that surround that. And there is definitely emotions of anger. I was at a Major League Baseball game a couple weeks ago, and I see a lot of the choices that are being made around me nutritionally and other lifestyle things. And I just think to myself, like, man, I'm the one sitting here with this diagnosis. And sometimes it feels like a bad person to think that, but at the same time, it's very angering to have those frustrations. And I'm sure a lot of people experience that. But to be honest, I only feel that every once in a while. Most of the time, it really feels like, okay, this is the next step. This is what we need to do. And I just keep moving forward.
Yeah. I mean, you can't beat yourself up for thoughts that enter into your mind. I think grappling with those kinds of emotions is perfectly natural and normal and in itself healthy in a way, right?
Mhm,
It's absolutely
mhm.
healthy. But let's kind of flip the script here, right? So that's kind of the doom and gloom and the why me stuff. But
Yeah.
the other way that we could look at this, at least I look at it, is because you just mentioned your infertility and your PCOS, and many said that that was a hopeless situation. You're able to flip the script on
Mm,
that. You have wonderful, healthy children now.
mhm,
Now you've got another challenge. So it's like, okay, well, let's do this again. And so while you were not able to prevent breast cancer, what the statistics and what the research also shows, though, is that with that healthy diet, with that healthy lifestyle, the outcome on this is so much better than it could otherwise be. Do you find solace in that?
Absolutely, 100%. And I think it's one of those things is that felt like, well, I did all the right things. Like, how could this happen if I did all the right things? And I think there are a lot of people, not even in just breast cancer type diagnoses, but also other chronic diseases and so forth. But then it's this realization that all the right things that you do or that you did actually are going to be the things that help you through this entire process. And I can say with 100% confidence for myself that my dietary and lifestyle choices are very much carrying me through this diagnosis. And Chuck, I'm sitting before you and I'm halfway through my chemotherapy treatments right now. I've had 6 cycles and I have 6 cycles left, and I still feel relatively really well. And I think those are the things that are helping me get through this process. And I had a major intense surgery in July that was 10 hours long with a long intensive recovery. And I walked to my follow up post op appointment only 2 weeks after my surgery. And so I really credit this to my diet and lifestyle, but also my attitude and things like that that helped me get through this entire path.
Well, I guarantee you that unless people knew your story, looking at you right now, if they're watching this on YouTube and they've had it on mute for whatever reason the entire time, first of all, turn your speakers on because this is a phenomenal, inspirational story here. But number two, you look absolutely fantastic. Like it would be impossible for anybody to say, "Oh yeah, she looks like she's really going through it right now." And that again is a testament to what it is you were just talking about. It's helping to carry you through this difficult time. I want to go back to your story because I kind of cut you off there when you would return from the conference and you're going in to meet with the doctor again on that Monday. So pick us back up. It's Monday morning. You return from the conference. What happens?
Yeah, so I go and have an appointment with the breast surgeon, and the original diagnosis that I was diagnosed the previous Thursday was DCIS, or ductal invasive carcinoma in situ, with microinvasion. So essentially, what that means is that they found that the tumor had stayed within the milk ducts with only like this tiny little bit that had left the milk duct. So this is actually considered stage 0 breast cancer very early on with just like this little bit that left. So that is the original diagnosis. When I get to the surgeon, she shows me the MRI. We start talking about it. And the other thing about this is that where I'm treated and where I'm going through all of this is the place that I used to work as an oncology dietitian. So I know all the doctors, I know all the nurses, and on a personal level as their colleague. And so this is something that's, part of my story, and that I think it'd be hard for some people to do that, but I've actually found it very encouraging to be with people and, they're taking care of me as one of their own, but they do that for every one of their clients, or their patients, I should say. But anyways, we get in and we're talking about it. And the first thing she tells me is, I kind of think I'm coming in here for maybe a lumpectomy, maybe radiation, and kind of move on, right? That's some of the story I had made up in my head with this diagnosis of DCIS. And it turns, she's like, I'm actually really worried that this is invasive, not just DCIS. And my mom and my husband were with me, and we just kind of felt like we got hit in the face all over again. And so I had to sit for another biopsy, and this was a mammogram and guided biopsy. And they took 12 other samples of the tumor that they found, and it still came back with this DCIS with microinvasion. So the next step was, okay, surgery. I was recommended a single mastectomy without sparing my nipple because where the tumor was located. However, once it came back to be a genetic mutation, it's an automatic recommendation for a double mastectomy. And then there's so many different pathways that women could choose to go down here in this particular scenario. So it was for me, it was a double mastectomy with no reconstruction, or you could have reconstruction with implants, or you could have reconstruction with something called a D-flap surgery. So I ended up opting for a double mastectomy with D-flap reconstruction. So essentially what the D-flap reconstruction is it essentially uses your own tissue to recreate the breast for reconstruction. And one of the biggest things that I think about in this process for me about how I ended up choosing the reconstruction path that I chose, and the fact that I chose reconstruction, is at the age of 33 of diagnosis, I wanted to be able to look in the mirror in a year, 5 years, 10 years, 20 years, 25 years, and think, okay, what is going to be the best emotional choice for me in this? What do I want to look at in the mirror that's going to be not so much of a reminder of this trauma, but also an uplifting, encouraging? And that's how I chose to go with reconstruction. Some women choose to stay flat, some choose implants, some choose this D-flap, and other types of situations. So this was the best choice for me, and I'm really happy with this choice, but it also means that it's a very intense surgery. It's a 10-hour long surgery where you have a breast surgeon and a plastic surgeon, and you essentially, all of your breast tissue is removed. In my case, both of my nipples were removed, and then also a huge, scar from hip to hip on my abdomen, and that's where part of the reconstruction comes into play. So we go into surgery knowing, and I had to wait 8 weeks for surgery. And I knew that it was by choosing this path, it would be a long time to surgery because it takes two very skilled surgeons and it's a 10-hour procedure. So it takes up the whole day for an OR. So waiting that 8 weeks to have surgery, knowing this tumor was still in me, that was incredibly difficult. And there's lots of thoughts and processes of like, okay, is this cancer spreading? What is it going to be doing in these 8 weeks? However, we do know from research that, most breast cancers take between 3 to 5 years to actually develop to the point where we can actually feel it. So in the grand scheme of things, 8 weeks is not a long time. However, emotionally, it is a very long time to wait. And we knew going into that surgery that I would have a sentinel node or a lymph node tested to make sure that there was no cancer involvement in the lymph nodes. If it happened to be that there was involvement in the lymph nodes, that they would not be able to proceed with the reconstruction portion of the surgery at that time because I would have to have radiation. And radiation can unfortunately very much impact some of the surgical outcomes when it comes to reconstruction. So going into surgery, we were praying for, no lymph node involvement. And if it was no lymph node involvement, the whole thought was, okay, I'd have surgery and then I'd be done. And it's a lot more simple than that because it's very much an emotional journey for the rest of your life as well. However, so we had surgery, the lymph nodes came back negative. I was able to proceed with the whole rest of surgery, and I just had this big recovery ahead of me. Well, fast forward about a week or so, I looked at the pathology reports that came back because in surgery, they send the actual tumor for further pathology to confirm this DCIS with microinvasion. And being in the healthcare space, I had looked at many pathology reports, although I'm not a physician. I mistakenly read the path report without talking to my doctor first. And I thought to myself, wow, I'm reading things that I don't want to be reading, that we didn't want to see. And what ends up happening is that it comes back as a different diagnosis. It is not DCIS. It is actually invasive ductal carcinoma, which means that the tumor has no longer stayed within the milk duct. It is actually spread throughout a little bit more of the breast. And during that process, then the next step is waiting for prognostics. Prognostics is essentially the estrogen receptor positive or negative component. And when we're talking about estrogen or progesterone, and then there's also another one called HER2. And it comes back highly estrogen and progesterone receptor positive, but we need to wait on the HER2 the next testing comes back that we don't know about the HER2, so we have to wait more and send for more testing. And so again, it's just this constant wait that so many cancer patients experiences, that fear and the anxiety and the unknown, this constant like knowing that if this comes back positive, I'm going to be having chemotherapy. And so long story short, comes back that there was actually multiple tumors within the breast. Although we were only feeling one, there was actually a couple of different tumors. One of the tumors was DCIS, but other tumors were invasive ductal carcinoma. And the DCIS was testing positive for this HER2 component. And if it's HER2 positive, it's kind of an automatic qualifier for treatment, essentially. And they were unable to detect in the invasive component whether it was DCIS positive. So we had to make this decision of, do we operate off of the fact that clinically speaking, this is HER2 positive? So, coming back to being an oncology dietitian, I very much understood all of this lingo and all the things that we were talking about, whereas my family and my husband were like, wait, what? And very much confused. So in this whole process, being an oncology dietitian, being in this space has been actually very helpful. And in some portions, it's been a curse at the same time, where you kind of know the stories, you know what to expect. And so from there, it was found that it was no longer just surgery that I would need. It was recommended to have chemotherapy, immunotherapy, and also endocrine therapy would be recommended once I finished treatment. So right now, I'm in the middle of my chemotherapy. I actually finished my halfway point last week. I get treatment every Thursday for 12 weeks with chemotherapy and immunotherapy. And after the 6 more treatments of the chemotherapy, I'll switch over to just immunotherapy every 3 weeks to finish out for another 9 months. So it's actually a much longer process and journey than we ever anticipated. But we're moving through it, and we're thankful for that.
For sure. And glass half full approach here. I would think that given the nature of your profession, I think that moving forward, this is going to help you have an even greater understanding of what your patients are going through and everything that encompasses a diagnosis like this. And you're getting, I mean, as much as it seems like they could throw at you, it seems like it's being thrown at you right now. And that gives you great insight and great wisdom. And I think that once all of this is behind you, all of that wisdom is going to be to the benefit of everybody who comes into your professional life.
Yeah, I hope so. I mean, that's the thing that I constantly think about. Yes, I'm doing this for me and my family, but if I can think about it, okay, how can I help just one other person? And even if it's just sharing my story of how we found this, right? And knowing that, yes, I was diagnosed at 33 and follow a very good plant-based diet and I'm physically active. I'm a healthy weight. I don't drink. I don't smoke. I've never done any of these things. I don't eat red meat, right? Like that's one of the things. You go into the oncologist and he asks you these questions and I can say, no, 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 I don't participate in these things. And I hope that it can be awareness that, yes, we can definitely reduce our risk of having breast cancer or other cancers or other chronic disease through these healthy lifestyles. But it also doesn't mean that it's not possible. And so from that, I really hope that people take awareness from it, right? Know your body. Had I not come home, felt the lump that my doctor was talking about, paid attention to it, and also known what my body normally feels like and listened to that intuition, I don't think that we'd be here at this point, right? I'd still probably be going on living my life, but we might find it at a much later stage and a much more difficult journey than we found it. And so I truly believe that my diet and lifestyle has led to early detection, and like it could have been a lot farther along. We don't ever know that. So yeah, absolutely. I hope that this experience only helps me help other people throughout beyond this, because unfortunately there are going to be women who experience this and go through this in the future. We, of course, everyone wishes that weren't the case, but hopefully I can have a powerful impact in early awareness and detection and help people throughout the journey as well.
How's your mind today? How are you
Mm.
feeling? I mean, you're halfway through the treatments. You're on the show. You've always been upbeat. You've always been positive. Are you feeling a little bit better about your situation today than you did maybe 6 weeks ago, 6 months ago? How are you
Absolutely.
doing? Yeah.
Yeah, honestly, I do have my moments where, I'm frustrated, I'm emotional, maybe a little bit angry, but to be honest, I am mostly have this attitude of like, okay, this is next. The first 4 cycles of chemotherapy, because I go weekly, it was kind of like, okay, this is the next step. Last week I told my husband before, I was like, is it really Thursday already? And we're doing this again? Like, because it kind of feels like it's this constant, you don't really get this break in between treatment to start feeling well. Although I do feel my best on Tuesdays and Wednesdays. And so I've actually been working a little bit through this entire process because it helps me mentally, it helps me emotionally, to move through this and know that I can help people through the process too. So in a way, working and doing these things it's part of the treatment process, it's part of healing for me.
What do you have planned for after the next 6 weeks are over? Like, is there a big party that's planned? What's going to happen?
Yeah. There isn't currently a big party plan, but I keep talking to my husband about having a little getaway vacation and we decide whether we're going to bring the kids or not. I have a 19-month-old, so she's kind of hard to travel with at this age, but I'm hoping that there's a vacation in the future just to kind of disconnect for a little bit.
Yeah, I think. I mean, it goes without saying that you deserve it. I mean, there's no question. You don't just deserve it. You need it. Like, get the doctor to prescribe it for you. For goodness sakes, just go. Pack your bags.
Yeah, absolutely. Yeah, no, we're looking forward to something like that. And it's been a journey for all of us. I have a almost 6 year old, a 19-month-old, and then my husband. And, it's been hard with the kids. And I almost feel like the hardest part of this journey is the kids, right? You still have to be a mom. You still have to get the pack back ready and the lunch ready and, all those types of things. And that's hard, but also one of the most encouraging things, right? Because you still have the kids, even though our 5-year-old kind of understands it. She knows what my port looks like. She has a stuffed animal that has a port in it that she sleeps with every night. So she gets it to that certain extent, but there's so much joy and there's so much that they love that is going on in their life that brings joy back to you. And that's really helpful. And
Do
a
you
lot of
think?
other moms that I've talked with before that have had breast cancer at a young age, say that one of the best things is that they won't remember this. They might have a fleeting memory of it, which in a way is encouraging at the same time.
Five, yeah, you never know how much a 5-year-old is going to retain. Having the stuffed animal with the port kind of, I would think, normalizes. I don't want to use that term normalize, but destigmatizes it, takes a lot of the scariness away from it. So I'm guessing like that's part of your goal here is like
Mhm.
this is what happens.
Yeah.
You don't have to freak out because mommy's got this thing right now. It's going to
Yeah.
be okay. And look,
Yeah.
here's your stuffed animal.
Yeah. And I think part of that too, I think one of the best things that we told our 5-year-old is my mom is a breast cancer survivor and she watches my daughter pretty regularly. And I think when we told her, we wanted to make sure we had all the information before we told her so that she could ask questions. And I think the best thing that we told her was that, grandma's a breast cancer survivor. Did you know that? And she said, no. And I was like, and look how healthy grandma is. And she plays with you and she can do all the things. Mom's going to be able to do that too. And I think that was the kicker to know that I said that mom wasn't sick. We just needed to get it fixed.
Mm.
And that other piece of my journey too is that I have been able to keep my hair through chemotherapy and using a cold capping system. So the chemotherapy that I am undergoing does cause alopecia or the loss of hair, but I've been going through a cold capping system that actually helps save your hair. And so after 6 cycles, you would never even know. And part of the reason why we chose that path for us is for our kids, so that I wouldn't look sick to them, so that we could help normalize life for them.
What is a cold capping system for those of us who aren't
Yeah.
familiar?
Yeah, absolutely. So during chemotherapy, I wear this thing on my head, essentially a giant ice pack. It kind of almost looks like you're wearing like this undergarment to a like a spaceship, right? So it's essentially the system that moves really, really cold water through the top of your head. And essentially, what it does is it affects the very tip of the follicles of your hair and constricts the blood vessels, so that some more of the chemotherapy is unable to be delivered to that very end of the cell. So I wear it for 30 minutes prior to infusion, during infusion, and also 60 minutes after the chemotherapy infusion. And that has successfully been helpful for me to save my hair. It's not allowed, or it's not able to be used in all types of chemotherapy and all types of cancer and tumor types. But for my type of treatment, I am a very good qualifier for it. And I do have very thick hair. So that is a very helpful thing in this process for us.
Okay, so it's a silly question. When we're talking like cold water here, how cold are we talking? Are we talking like 1 degree above freezing?
We are talking about when I take it off my head, there is a layer of snow or ice on the top of my head. So it's very cold. I'm under a blanket like this. And then the other thing is that my chemotherapy also can cause peripheral neuropathy, which is the tingling and numbness in your fingers and toes. So I'm also icing my fingers and toes during the chemotherapy. So I have ice on my head, ice on my fingers, and ice on my toes, and a giant big blanket to help me get through that about 2.5 hours that I'm doing that. And it's not fun during it. Honestly, it is a very intense process that's very uncomfortable. However, I've been able to save my hair, and knock on wood, I don't have any peripheral neuropathy yet. And peripheral neuropathy can become permanent. So these are all strategies that I'm using to help lessen the path moving forward for me.
I'm just going to throw this out there that whatever vacation you take at the end of this should be someplace warm,
Yes,
tropical, sunny beach. Just saying. Wow.
that is what I am imagining, Chuck.
Yeah, that is intense. That is
Yeah.
next level intense, man. You're a
Mhm.
warrior. A couple of questions here. I want to turn over to the diet portion of things. Have you had the
Mhm.
opportunity with the team that you've been working with, your team of doctors, to talk to them at all about nutrition and some of the research that you're familiar with and how that might help their patients?
Yeah, absolutely. So as I mentioned before, this is actually the cancer center that I worked at when I was in traditional practice. I'm now in my own private practice, so I'm very familiar with the medical team, my oncologist. I picked based on knowing him when working at the cancer center. So I'm very close with the team, and they also very much know my approach to nutrition. So I have been able to talk to them about it. And I'm very open about being a guinea pig for them, such as the cold capping. This is a very new thing that they're offering at this cancer center. So I pretty much tell all the team, like, come on, you can come look at it in action. But they're also very open to my nutrition approaches during chemotherapy and so forth. So I'm using an approach that's not necessarily super well known during treatment, and that's fasting before and after chemotherapy. I am definitely my own guinea pig. There is some research on it, but there also needs to be further studies on it. And my physician is very open to it because they are very open to the fact, because they know that I'll do it appropriately and in a smart way. So that is something. And then also, there are two dietitians at the cancer center that I work at, and one of them I actually hired myself, and when I worked there. So I have a dietitian that follows me, and it's one of those things is that I'm very open to the fact that everybody has different ideas, and so I take what they recommend, and I also share with what's been working well for me, so that hopefully it can be helpful as they go moving forward with working with patients too.
I'm curious about the fasting approach here. What is the theory behind that, and what is the research showing?
Absolutely. So the research is still in a little bit earlier, the studies. We do need more clinical data, and there are some contraindications of when someone should not fast prior to chemotherapy. However, the research varies a little bit in terms of what the protocol would look like, depending also on the treatment that that person is receiving. So I receive weekly chemotherapy. So when I actually thought about doing fasting for myself, I thought, ooh, weekly fasting is a little bit too much from that standpoint, because we also want to make sure that the patient is nourished enough, doesn't lose too much weight, isn't risking malnutrition or sarcopenia, which is like the involuntary loss of skeletal muscle. And those types of things. And so, really, what it looks like for me is I'm fasting a period of time for a certain number of hours prior to chemotherapy infusion. And then also, I finish that fast 24 hours after chemotherapy infusion. So, there is each week, there's about 2 days or so that I'm only drinking water. And really, the theory behind it and what the research is showing is that it can help protect the healthy cells. The way that I describe it is that our healthy cells are actually really good in times of famine, right? During times of starvation. So when we're not consuming calories, our bodies kind of go, and these healthy cells go into this protection mode. Cancer cells they don't have this protection mode. They have one mission, and one mission only, is to grow and divide and be as big as possible. Okay, so if we're fasting and then we get chemotherapy, your healthy cells are somewhat protected. And then it's also been shown that the cancer cells are going to uptake the chemotherapy more efficiently and be more effective against the cancer cells. And research is showing promising results in improved quality of life and reduced fatigue, and also reduce side effects after chemotherapy during this fast with implementing this fasting phase. But again, everyone does their chemotherapy in different routines. So mine is weekly. Some people experience it every 2 weeks, every 3 weeks, some even every month. And so that really needs to take into consideration. And I have modified my own fasting as a result to make it more sustainable, because there was one cycle where I lost about 2 pounds in the 1 week. And I thought, ooh, I have 9 cycles left. This is not sustainable for me to lose this amount of weight in this period of time. So it has to be a constant check-in with your medical team, and hopefully an oncology dietitian on your team as well, to help you bridge what's important and what works for that individual. But I've seen really good results, but to be honest, I haven't tried a cycle without it. So I don't really know exactly what the control would be. But I have very minor nausea. I have really good energy for the most part throughout treatment here. And I would say that I think it's part of aiding in how well I'm doing with the cold capping and the icing my fingers and toes and fasting. There's a lot of things that I'm doing to try to help myself through this process, and I think it's really helping. At least if it's a placebo effect, I will take it.
Do you try to eat things that are a little bit more calorically dense, knowing that the fasting is coming, or are you still eating your regular diet?
Absolutely. I do try to increase my caloric load before and after the fasting, because the biggest goal throughout the course of chemotherapy for pretty much any patient is actually to maintain weight. Whether that patient is clinically overweight or obese, or the patient is at a normal, healthy weight, weight maintenance is the primary goal throughout the course of chemotherapy. So I watch that very closely for myself and with my medical team. And that does require me to eat a little bit more calories before and a little bit more calories after the fast. But I'm only plus or minus 1 or 2 pounds since the start of chemotherapy after 6 cycles. And that's a really good place to be for myself.
All right. And really quickly here, let's talk about cancer risk eating that standard Western diet, high fat, lots of calories, lots of
Mhm.
highly processed foods, and then, cancer risk for again, we're going to say the average person, because as we've learned here today, there's no such thing as a, sure thing. So
Yeah.
the risk on the standard diet versus the risk eating a really healthy, clean, primarily, if not 100% whole food plant-based diet.
Absolutely. I mean, the risk of, the average person walking down the street of developing breast cancer for a woman is 1 in 8. And that is without a known genetic mutation, right? So I do have a known genetic mutation. So, but when it comes to when we see a standard American diet to a whole food plant based, and let's even just say like plant predominant, we see the best reduction in cancer risk between the standard American diet and a whole food plant based vegan diet. We see there's also improvements in risk reduction when it comes to a vegetarian diet. And so anytime we can move towards a more plant forward, whole food, plant-based forward approach, we see a reduction in breast cancer and cancer risk itself. And that's really, there's so many factors that play a role in why that can help reduce the risk of cancer, starting with the microbiome, IGF-1, which is insulin-like growth factor, which is actually reduced in consuming a whole food plant-based diet. And the list goes on and on and on. So, and reduction in inflammation, right? It's not even just cancer, it's about overall chronic disease that we can definitely see a drastic reduction in when we follow a whole food plant-based diet.
And what are some of your favorite foods? I was interviewing Dr. Christy Funk this month as part of our Let's Beat Breast Cancer series, and she's really big on the Indian gooseberry and on
Yeah.
strawberries. What are your
Mm.
really big must-have foods?
Cruciferous vegetables. So cruciferous vegetables are anything that's broccoli, kale, cauliflower, cabbage, these vegetables that fall into this cruciferous or like cross formation growing vegetables. And the biggest reason that I'm a big advocate for them is truly because of the glucosinolates and sulforaphane, which are these phytonutrients that fall under these these vegetables that have some of the best cancer protective qualities. So I personally aim to always have cruciferous vegetables in my day, if not just one serving, multiple servings. And I'm also finding during chemotherapy, we tend to have a lot of people tend to have like food aversions or even cravings. And I find that I just want all the roasted vegetables. And lately it's been a lot of broccoli and cauliflower for me. And if I were talking to an individual about, what is one food, right? Because we know it's not one food that can reduce the risk of cancer overall. It is definitely the overall dietary pattern that is the most important. So it's really hard to pick one food, but if I were to pick one, it would be cruciferous vegetables, and then take that up a notch to like broccoli sprouts, where we have like 100 times more sulforaphane in the broccoli sprouts than we do in mature broccoli.
How do you roast your broccoli? I'll tell you,
Yeah.
I'm a really simple kind of dude. Like I will steam it just a little bit so it gets a little bit soft, and then I'll roast it. For me, and I'll do that sometimes even without any kind of seasoning. I just think that the roasted broccoli flavor alone is super, super, super tasty. I would love to know what your roasted broccoli recipe is.
Honestly, like, I think I'm gonna disappoint you, Chuck, because I prefer steamed broccoli over roasted, and the reason for I like the flavor of the roasted broccoli, but I really struggle with the fact that roasted broccoli tends to, like, burn on the floret so much if you don't have it, like, coated in oil, and we do, really recommend trying to reduce our overall oil consumption, or at least keep it low. I think there are some great strategies that other people have to help reduce some of that burning and that need for oil in order to roast. But I'm more of a steamed broccoli. Like yesterday for lunch, I had tofu and steamed broccoli, and I had some noodles that went with it with a little bit of a sauce, and that seems to be my go-to right now. So I guess I'm kind of disappointing you with the best roasted broccoli recipe because I don't really have one.
There's
Cauliflower roasted is mine.
Oh, okay, okay. Well, now we'll get to that, but there's no disappointment. Look, I mean, it's your
Yeah,
broccoli. You eat it however the heck you want. It is
that's right.
Allison's broccoli. Who am I to tell
Yeah,
you how to eat your broccoli? Come on, that's just
yeah,
silly talk.
right. Yeah.
Uh, all right, but the roasted cauliflower, you just said that's
Mhm.
your jam. All right, so give me
Yeah.
give me the secret sauce here for roasting cauliflower.
Yeah, so I cut it into the smaller sizes, and then I use a blend seasoning that has salt, a little bit of salt, black pepper, and garlic that I sprinkle on the roasted broccoli, and I put roasted at 425 degrees on a parchment paper. So the parchment paper helps prevent that sticking, and also still allows some of that caramelization to happen. And depending on the size of the cauliflower, it's usually in there for about 20 to 25 minutes with about a stir in between. To me, that the black pepper, and I think it's the garlic that really does it for me, that I like on this roasted cauliflower, and the 425 degrees I find to be the perfect amount for it.
There you go. All right.
Hmm.
I'm gonna try that. I'm gonna let you
Yeah,
know how it goes. That sounds
yeah,
amazing. I
it's really good.
roasted vegetables are just the greatest thing since sliced bread, and it surpasses sliced bread easily, in my opinion.
Totally.
Yeah. So, last question for you. What is your prognosis as it stands right now? What if the doctors told you?
Mhm. Yeah, so thankfully, my breast cancer is very curative intent throughout so if by going through this whole process, I'll reduce my risk of recurrence to about 5.5%. If I proceed with endocrine therapy, which would be like tamoxifen for me, then I can reduce it down to another 3.5%. So I have a very curative um, breast cancer that we caught very early. So, like I've been telling a lot of people, I do believe that I'm going to be well at the end of this. I do consider myself pretty well, even throughout this, but it's just a little bit of icky to get there.
I like that. Just a little bit of icky. Just a
A
little
little
bit.
icky.
It's,
Mhm.
it's, it's, it's palatable. We can do it.
Mhm.
Just a little icky.
Just a
Uh,
little icky.
I would love Allison to stay in touch with you and be able to keep our followers or the exam roomies up to date with how it is that you're doing. I think that there's going to be a lot of people invested in your story now and sending you all kinds of good vibes and well wishes as you continue down your road to recovery. So if you're up for it, I'd love to check in with you from time to time just so we can give the roomies an update.
Absolutely. I'd love that. And, all of the support, I could say for certain that me and my family wouldn't be in this place where we are today if it weren't for the support, helpful thoughts, prayers, everything throughout this entire process. And it takes a village. It's not just me and my husband. There's so many people around us, and and I also believe that the survivors that came before me, they were key to a part of this for me, because they helped me be aware. They helped me pay attention, and I hope that I can help people be aware and pay attention as well. And we'll take all those happy thoughts, vibes, prayers, whatever it is for anybody. We'll take it, because it's definitely making a difference for us.
Plenty of happy thoughts from me to you, your entire family, for a swift recovery. I think that this has been a really enlightening 45 minutes, and I thank you so much for your time and continued success and continued path back to health. And thank you for being such a brave warrior in all of this. You are truly a remarkable person. So it's been really a privilege to be able to have this time with you.
It's been a privilege to be here. Thanks so much, Chuck. I appreciate it.
If your health IQ is a couple of points higher than it was a few minutes ago, go ahead and like this video or subscribe to the YouTube channel. And to take it even higher, head over to Apple Podcast or wherever you get your favorite shows. Look for The Exam Room by the Physicians Committee. Hit the subscribe button there as well, and help to make your world a healthier place.